with maybe L2, L3. I'm going to rotate, I'm going to side, you can rotate to face me there. Okay, first thing I do is I locate, so I'm on about to L2, L3, the segment target segment. I'm going to grab his feet, I'm going to flex his hips, these to about the point where I feel motion at the joint. I get you to straighten out the bottom leg, okay? We can bring varying amounts of extension or flexion into it. We just make sure the leg is straight. That's losing tension, so leave it there. Drop the foot into the popliteal surface. So here we are here. Just tape up a bit. Okay, next thing I'm going to do is place the hand on the waist like that. I'm going to hold the arm above the elbow. See the way he's here like that? And I'm like that. And I'm just going to rotate him across like that until I feel motion at the joint that I'm looking for. L2, L3. I'm going to place his hand here like that on his wrist. He's actually, for a big guy, he's pretty flexible. I'm going to come through here. So some people are kind of down here. Your elbow needs to be the soft part of your elbow, the ulnar surface of your elbow, smoothly across the lateral pectoral area. You're going to stabilize the shoulder with that. So if you put a thrust and this isn't stabilized, the whole body will roll and you'll lose all your accumulated forces. So that's in here. I'm creating my arrow here, so just put the fingers here. They won't remain here with this hand at the point where the L2, L3 is. Now I'm using this to rotate him over like that. You were trying to do this, look. Can't do that really. I'm just rolling him like that. I'm close to him. Also, some people are standing out here. It's going to hurt your own back and it's impossible to express force from here. Much easier if I'm really close. Like that, because you see, I know some really small practitioners who are just brilliant at this, with big people. Just like they just use get every inch there, like they just use all the different, take all the advantages they can. So now I've allowed him to roll a bit, so while it's not compressing, we're not securing that yet. Now he's at a point where, okay, I can put a thrust comfortably through there. I need to secure this shoulder in place. So that hand is there. What I want you to avoid doing, or see some people maybe trying to do, is this, right? It's not that. This is only to keep that in place. This is static. There are occasions where you might put a slight thrust through the shoulder to get the upper lumbars, but not in this case. We're just fixing that in place. Rotating across to here. I'm leaning, watch where my leg is, and nearly there's a lot of body contact between myself and David here. I'm pressing down like that. And the thrust is, my back leg is here, bent. I'm on the balls of my toes, so it's like a fighter stance. And then it's a sudden, I'm just winding it up a little bit. What you have to be careful of is coming off, losing all the forces to come on. Then it becomes a high amplitude, like a sponge, and you won't accumulate the forces, it won't adjust. So you're taking all the slack out. You might have to do that a couple of times just to feel where the barrier is. So wherever you feel the barrier is there. And then it's when I get that, I won't adjust it, leave for someone else maybe.
No, you can adjust it if you want.
And winding it up, and then it'll be there. Okay? We've got a nice little adjustment there. We've got, whether which, just the ones we picked at random or the ones that adjusted, the reason they adjusted is because I was pointing my force at those. So what do we get there? L2, L3, L4?
3 or 4 clicks up along there.
Yeah. Okay, so that's it. Is that